is also a triggering factor of asthma symptomology. So the more allergies a person has, the higher risk they're going to be for asthma and an asthma attack. Moving on to the pathophysiology of asthma. In an attack, a person's airways are becoming swollen and inflamed. This causes shortness of breath and difficulty breathing. The smooth muscle around the airways also constrict, causing the bronchioles to narrow. There's also extra mucus being produced during an asthma attack. And as you can see in this picture, it shows a normal lung versus an asthmatic lung with the swollen lining of the airways, along with the excess mucus and the smooth muscle tightening. Talking about the pathophysiology more, there's an early phase and a late phase of an asthma attack. In the early phase, IgE antibodies are released by plasma cells. Once they're released by plasma cells, they then can respond to environmental triggers like dust mites and fungus. These IgE antibodies then bind to mast cells when the mast cells come in contact with the environmental trigger, and the mast cells then release histamine and leukotriene, which cause the smooth muscle to contract. Moving on to the late phase, this usually occurs a couple hours after the early phase, and when this occurs, basophils, neutrophils, helper cells, and T cells, they all localize to the lungs and cause further inflammation and constriction, as seen in this picture. Now, moving on to the risk factors and signs and symptoms of asthma. The main risk factor for asthma is a family history of asthma. As stated earlier, it's not required to have a family history of asthma to be diagnosed, but it's very common. Other risk factors for an asthma attack include allergies, as stated earlier, other respiratory infections, smoking, obesity, and air pollution. There's also the ethnicity and the age and gender. The main signs and symptoms of an asthma attack occurring are shortness of breath, dyspnea, wheezing, and a tight feeling in the chest. Common secondary symptoms also occur due to these symptoms of shortness of breath, dyspnea, and wheezing, and a person's going to be very stressed, and they may panic. And when a person is panicking, this is going to cause further difficulty breathing. Now, right now, there's no cure for asthma, so people do the best they can to manage it, and in most cases, it is manageable, and people are able to live at a high quality of life. They do this by avoiding their triggers the best they can, and also trying to live a healthy lifestyle, not smoking, a good diet, exercise. The testing and diagnosis of asthma, the gene or genes that is responsible for causing asthma is still unknown, as stated earlier. So the main form of testing is a family history evaluation and a physical exam. As stated earlier, it's very common to have a family history of asthma and then be diagnosed with asthma. So when they look at a person's family history and see asthma, they're going to know the person's at a higher risk of having asthma. A pulmonary function test or other lung function test may be done. This is going to be to compare the person's scores to the benchmark scores of an age group to see if their lungs are performing correctly. In many cases, asthma is diagnosed after an asthma attack, and diagnosis is much more common in children. A lot of times, people don't know they have asthma until they have their first attack, so it's hard to diagnose it before someone has an attack. Ruling out other diagnoses and diseases is a common way to reach a diagnosis for asthma. Since the symptoms like shortness of breath are common with many diseases, they first need to rule out other diseases to make sure a person does not have those. Moving on to the treatment for asthma. The number one treatment is prevention. There's no other way to put it. The most common treatment, though, when you're talking about treatment, is a personal rescue inhaler, and that'll be talked about a little more later. People with asthma are usually going to have multiple of these, one at work, one at home, one in their car. This rescue inhaler is going to contain a bronchodilator that's going to relax the bronchioles, and it's going to help them breathe. Glucocorticoids are also given to reduce inflammation, but this is usually in chronic cases of an asthma where a rescue inhaler isn't doing its full job and their bronchioles are still not relaxing. Controlled breathing techniques are also used to reduce panic and remain calm, and this is going to help them breathe as well. When you're calm and not panicked, you're going to have better breathing than when you're panicked. There's also a medication called leukotriene receptor antagonist, and this is a prescribed daily taken medication that will prevent asthma attacks from allergen triggers and exercise, so a person can still live a healthy lifestyle and a good quality of life. Now, my specific career field is nursing, so this situation will mostly be based around an emergency room nurse, as a person having an asthma attack going into the hospital is most likely going to go to the emergency room. So if a patient arrives at the hospital knowingly having an asthma attack, you first want to see if they have their rescue inhaler. If they have their rescue inhaler, this is going to be quicker to take than getting a bronchodilator from the hospital. You also want to make sure they haven't already used it, because you don't want to administer too much medication. If the rescue inhaler isn't working, glucocorticoids can be used, and this is going to help reduce the inflammation and attempt to help with the breathing. Once the medication is administered, it's now up to time to stop the symptoms, and you want to help try and get the patient in a calm state so that they can breathe better. When someone, as said earlier, when someone's panicking, it can be much more difficult to breathe. Now, this is a picture of just what an average rescue inhaler looks like, and many people with asthma are going to have multiple of these. Now, when talking about being a nurse in relation to asthma, the follow-up care is going to be the main part, and it's essential in the prevention part, in trying to prevent recurring attacks. A nurse has a huge responsibility to educate the patient on the things that they can be doing to manage their asthma. First, the nurse can show a patient how to use their rescue inhaler, make sure they have the proper technique to administer the medication properly. They can also show them new breathing techniques if they don't know any, to help them stay calm during an asthma attack. A nurse can educate a patient based on their personal triggers for an asthma attack on how to avoid these triggers, how to stay away from them, as this will prevent recurring attacks from happening if they're not exposed to the triggers. One of the most common things a nurse does with a patient who has asthma is they work to develop an action plan when a person's having an attack. This is pretty much a step-by-step plan of what they're going to do when they have an attack to make sure it doesn't have other problems and that the attack can be solved. A nurse is also going to go over prescribed medications with a patient, make sure they know how to take the medication, make sure they're taking the medication properly. These rescue inhalers, they have an expiration date, so you want to make sure the patient's inhalers aren't expired, because this could reduce the effectiveness of the medication. And if you have a patient who smokes and has asthma, it's very important to try and get them to stop smoking and educate them on the benefits this has, not only to their overall health, but in regards to asthma. And now I'm just going to leave it on the reference slide for a little.